All right, if you're watching this, you're here to see us about Gynecomastia PreOp. That means you've scheduled your surgery and you're going to be coming in and seeing Stacy for your pre-op visit. She's going to do several things with you that are important. The most important of all the things, and I'm going to let her talk about that, is the paperwork that you're going to get. You're going to get some paperwork in the mail from Samantha, our patient coordinator, and Stacy's going to tell you a little bit about that.
You'll actually get it via email, and sometimes it gets into your junk mail, so we request that you make sure you look through that if you don't have it after you've scheduled your appointment. You'll go through that, you'll read through it extensively, make sure you read every page because you're going to be signing that consent once you come in at that pre-op visit. We also request you to get, if we've asked you to get any pre-surgical labs, any EKGs or anything prior to surgery, that you have those completed before you come in for your pre-op visit. We want to make sure that those are completed so there's no delay in your surgery. Medications I will prescribe to you as well today, and I will send those via electronically today, so make sure you pick those up within the next couple of days to ensure that you have those the day of surgery. I'll also talk to you about your compression garment, ordering that, making sure you have that pre-surgery as well. Want to make sure you bring that with you to surgery, because after surgery they're going to put you in that, and make sure that you're wearing that for 4 weeks, as Dr. Green had talked to you about the consultation. Make sure you're wearing that, but we want to make sure you have that ordered before you come in for your surgery that day.
That is super important. I appreciate you saying that, Stacy. That's I think that's one of the most common things that occurs, is that men forget to bring their compression garment to the surgical day, and we do want to be able to have that in the OR so we can put you in that right away to reduce that swelling, because that's going to make you feel better. If you have swelling there and we're just wrapping you with an ACE wrap, it won't be quite as effective as your compression garment. So your compression garment can really help reduce that swelling, which will reduce any discomfort that you have post-op. And most men don't have too much discomfort. First couple days are a little sore, and it will remain sore for maybe a month or so, sometimes a little bit more, but not so sore that it really prohibits most of your activities. You should be able to get back to doing pretty normal things within a day or so, other than those strenuous things and working out. The other thing to tell you is when you come in for your pre-op, Stacy's going to take pictures of you so we can look from side to side, make sure we can see the differences from side to side so we know exactly how much to remove. Some of what I do is I see on the field, but sometimes just looking at you on the surgery table, there's questions that I can't completely answer by what I see, and I need to see a picture of you standing also, so that I can answer extra questions for me so I can optimize your outcome for you. And I think that's it. I think that's the pre-op for gynecomastia.